And another great thing is we're going to talk about a little different subject about wellness, not just about cannabis, but the wellness subject I think is a critical one. There's so many myths out there for lots of reasons, but we asked Anna to assemble a panel to, teach us as we seek to understand what, how how cannabis and CBD are being used in health and wellness aspects. So with that on, I'm sharing my screen, but could I give the screen to you?
Yes, I just need to figure out how to do a full screen version of the slide. So I'm trying to do that, but I can certainly share a screen for the deck. Give me one moment here.
Or Anessa can do it for you.
Yeah, I can run it. I was chatting with Anessa earlier, so I'm just trying to figure out how to get rid of all these side items here. So yeah, let me start off by saying a few. There we go. A few comments, and then I'll launch into the panel. So thank you, Mark and 361 Farm. As many of you know, we've been doing a number of cannabis events on Zoom, and we're looking forward to the Midwest tour and meeting folks in person on the cannabis panels. Hope a lot of you are joining. I know I'm looking forward to meeting many of you in person. So on the cannabis front, it's now fast evolving to connect with the wellness space. I'll say a few high-level comments on that. There are surveys coming out more recently about the user base for cannabis shifting from the folks that have consumed it historically, whether it was in the black or gray market, and we're kind of the core foundation of a lot of the legalization recreationally and medicinally in cannabis. And now there's a new wave of people coming that weren't as aware of cannabis and the effects it has. And the newer wave tends to be people who are, let's say, 35 or older, are wellness focused, are sometimes microdosing or using it for medicinal purposes or using it for things like exercise. If you take cannabis while you're training, many professional athletes find that to be a much more focused and effective workout and training than not using it. So we're going to explore this in a number of ways, but I wanted to lay the groundwork for everybody, and I know people are still kind of joining in, so I'll give it a minute before I launch into things. But don't feel afraid to ask any question on this session. This session is really meant for people to have a very fundamental understanding of the cannabis plant, as well as how it impacts the body, and how are some of the forms that people use to consume it, whether it's flower or vaping or in water soluble or liquid forms. So a lot of the topics we're going to be covering, we want to have a very basic and fundamental understanding of all of these things. And I can also tell you that I know people who have been in the cannabis space, as I have for many years, who have gaps in their knowledge. And there is no easy way to follow research in this space. There is not federal funding for this space, so the US hasn't even fully joined in on the research capabilities that are needed for the space. But there have been people involved in the space for a number of years, including some of the speakers we have on the panel today that have practical knowledge and also are involved in indications that could have huge impacts on things related to health and wellness. So I'm just kind of going to lay out the process for the session today and the agenda as people join. I see a number of people just came in to the Zoom, and then we'll get started with the panelists giving a short bio of themselves and their background, their involvement in the space currently. They will then talk about whether it's in slide format or if they want to just speak through a few items, what they would like to communicate today in terms of talking points to you all. And then I'll ask a few basic kind of framing questions about cannabis, and then we're going to open it up to the audience. There's only 3 panelists today. That is by intention. We wanted to have fewer panelists and have more deep dive conversation, and we definitely want a lot of participation from the audience. So I see a number of people have just joined. I'm going to get started. So we're going to start off by going through each panelist. If somebody's running a little too long, my background will change. As you're aware, I try to make sure everybody gets enough time. If you have questions from the audience, please feel free to put them in the chat so we have kind of a running queue. Darla, if you can watch for those questions in case I don't see them in my multiple screens as I'm going through the event, that would be great. And so I'll kick things off. I'll say this: Bar Capital has been involved in space now since 2017, when we first found out about the opportunity. I have traveled to Israel, Europe, all across North America, and we are now growing our network in Africa, South America, Asia, Australia, because this space, the cannabis space, is growing extremely fast. And basically the black market supply chain is being replaced by the legal white market supply chain, and the bigger brands and the bigger ways that people are consuming it are growing very rapidly, despite it still not being federally legal. So we get involved in a few areas: strategy, capital, and execution. And so these events are a great way for us to increase our own knowledge about what's happening in the space. So we try to attract really high quality speakers, as I'm proud to say we have today. I'll start off with Jay Spall of Alt. He's the Chief Scientific Officer there. Jay, if you could just give us kind of a minute summary of your background and your current involvement and what you do. And then, give us an overview of what you see happening in the space, and any kind of high-level understanding of how you understand the plant and how you got involved in its recreational or medicinal use.
Thank you, Nand. Hello, everybody. I'm Jay Spall. I'm the Chief Science Officer with a company called Alt, Advanced Liquid Technology. It's a nanotechnology company. I got involved in the cannabis space for medicinal reasons, for personal reasons, about 15-ish years ago, due to an injury in hopes to avoid opioids. So my entry point into cannabis was in cultivation. From cultivation, it evolved into extraction, distillation, then lots of product formulation about half a decade ago. Within the product formulation area, went deep into innovative product development and have focused quite a bit on nano emulsion side of things for the last 3-ish years. Was also in the hemp space in the Midwest for about 2 years. Yeah, that's kind of my intro. And Anand, you gave a beautiful intro to cannabis. I feel like the cannabis space, it's a global movement now. It is not just in the US. It is a global movement, and it's going from black, gray to a corporate level, and it's getting regulated. So there's a great opportunity for us to help people on the compliance side create ethical products, create products that are easily dosable, precision dosed, in hopes to spread it correctly and properly. That's what I got, and I'll be happy to take any questions, dive in at any time.
Thank you, Jay. Appreciate it. And I know, Jay, you may have to kind of step in and out because you've got a live experiment underway. And so appreciate you kicking things off. I'll next turn it over to Isaac Foster. Isaac, if you could give some background on your self and as well as your involvement. And I know you've got some slides you want to share, so I'll cue those up as you give your background. You're on mute still.
Can you hear me now?
There we go. Yes.
Can you hear me?
Yep.
Excellent. None. Thank you so much. Hi, everyone. My name is Isaac Foster. I'm the CEO of Entourage. I originally grew up in New York City. I was an investment banker for 10 years, focused in tech and healthcare. For the last 20 years, I've been involved in 10 startups, either as CFO, CEO, or COO. I got into cannabis in 2016. I am the co-founder of what is the largest physical wholesale marketplace for recreational cannabis in the state of Oregon. And in 2018, I co-founded Entourage, which is focused on creating indication-specific hemp-derived or cannabis-derived therapeutics with proof of efficacy. In fact, we are expecting results in Q4 of this year on from a human trial for one of our formulations to treat long COVID. If we're successful, we will be the first therapeutic with proof of efficacy for long COVID. And with that, if you have slides, and I think as we look at cannabis, I don't.
Sorry, Isaac, we've got a bad connection on your end, so it's hard to hear you.
Apologies. Is it? Let's see if I.
Yeah, right now it's sounding pretty good. Can you see your slides now on the screen?
I can, yes. If we go to the next slide. So for those of you that follow Silicon Valley, first principle thinking is really a big topic, and it's really important if you're going to think about the medicinal use of cannabis, example, just so that we're all talking about the same thing. With first principle thinking, you need to distill things down to their simplest element. And what we can see here is the letter R, when considered in the context of a written language, the simplest element is the letter itself, right? And so if you start with letters, you can build sentences, you can build paragraphs, and then the letter R, its context is always known in written language. The same letter, it used in a math formula, though, the simplest element begins with its definition, right? Because you can make the letter R anything you want. So in this case, in math formulas, letters are the second element, not the simplest element. And if you treat letters the same in both instances, it guarantees that your conclusions will be inaccurate. So if you go to the next slide, and I only picked 3. There are actually probably dozens. But the first crucial things to grasp is, number one, everything we've ever been taught by the government, by our school systems, by the norm is a lie. And I say a lie because it was deliberately spread knowing that it was inaccurate. The second thing is, unlike traditional pharmaceuticals, there is no single magic molecule. And then third, for broad therapeutic use, it is not the simplest element in the equation that FDA approval is required. So if we go to the next slide, and this is just a prompt, a deeper dive. If you haven't looked at this before, please do your own research, come to your own conclusions. We're still in the early days. The first thing we were all taught is that using cannabis is going to damage our brains. And the truth is, in the actual studies where they study people's brains in cannabis, it looks to do exactly new things. Another big constant assumption is that smoking cannabis causes lung cancer, when in fact, there is no study that is controlled for things people smoking cigarettes are exposed to other causes of lung cancer, where this idea that people can OD or die from consuming too much cannabis, when in fact, there has never been a death recorded associated with cannabis, and it is not.
Sorry, Isaac, we're having trouble hearing you. You might want to turn off your.
But it's more.
Isaac, you might want to turn off your video, and I'm going to do the same just so we get a better signal for you. But you're kind of coming in and out. So if you could repeat that last point, you can repeat that last point in terms of deaths reported.
Yes. So it is not inaccurate to say that more people die each year from a water overdose than from a cannabis overdose. Next slide, please. And pharma has definitely taught us that the key to therapeutic use is finding a single magic molecule that you can then synthesize in a lab and achieve 99% purity, and then that's what medicine is. And in fact, when we look at THC and or CBD, use in isolation are typically 80 to 90% less effective than when you use the pure extract from the mature virgin, right? So seedless female flower of the plant. There's also this idea that it's all. So I'm going to have this one product and it's going to do everything. That the most effective use is when you match specific varieties of the plant for specific therapeutic uses. The other idea that we're going to isolate or synthesize ingredients, right? So many people looking to make synthetic versions of specific cannabinoids, sometimes of terpenes. And to date, every attempt in that direction has been inferior to using a simple full flower extraction. It may not be as patentable, but from a therapeutic standpoint, it is far superior. Next slide, please. And then in terms of FDA, so from a first principles perspective, we have to ask the question, what does FDA approval really give you? FDA approval gives you the ability to publicly and broadly in public claim that your product has certain medicinal purposes. It is not required for your physician to recommend its use. For example, your physician can recommend a change in diet, or that you exercise, or that you meditate, or that you do deep breathing. And based on the classification of hemp-derived products in this country, depending on where they're manufactured and where they're sourced from, FDA approval is not required. And when you consider the differences in the development path, right? If we, again, use the simplest element, when you're starting with a poison, so something that you know or suspect in large quantities will kill someone, it requires a way of handling that to prove its efficacy. And that's the traditional FDA phase 1 through 3 that we're familiar with, right? You start with something that you know or think will kill someone. You spend some time figuring out how it works. You get a thesis, you move to the petri dish, you do some animal experiments. And then when that's all out really great and you find lots of funding, you can begin your FDA phase 1 through 3, which takes about 12 years. And so 17 years later, $2.3 billion, we have a therapeutic on the market. And if you start with a poison, I highly recommend that process. Now, if on the other hand, you begin with something that you know is non-lethal, and in this example, I just, I'm using water for simplicity, and in the case of cannabis, where we literally have mountains of preclinical work in humans that you can read and study and derive information from. So I'm saying 2 months for that. Do a formulation based on what you've learned. You can develop and execute on a human trial to prove your thesis and show actual efficacy, and then go to market. So on the right-hand side, starting with a non-lethal substance, we can see that we can get to the same clinical place, or let's call it a near equivalent clinical place, in 1 year and for about $1 million. That is a game changer in the development of therapeutics for human use. I think that's the last slide.
Thank you, Isaac. Appreciate that. And appreciate you sharing the kind of process by which different approval levels are looked at, and we'll get into this part of the discussion in momentarily. So appreciate you covering that for us. And next up, I'll introduce or turn it over to Dr. Jun Chin, who, in my experience, and I've been in this industry for some time, is the longest kind of serving cannabis-related physician that I'm aware of in the United States, and maybe Israel tops that out, I'm sure. But if you could give your background, Dr. Chin, and then I'll queue up your slides meanwhile.
Hi, everyone. So happy to be here with you all. So I was a patient before I even became a physician. As a teenager, I was diagnosed with ankylosing spondylitis, or AS. It's a progressive type of arthritis that affects the spine. And frankly, cannabis changed the trajectory of my life. If it had not been for cannabis treatment, I would not have been able to finish med school and become a doctor. So I had this educational advantage. I did med school in California. Just to give you a reference, California legalized cannabis in '96, and I was in this middle of a switch box. So I learned holistic, integrative cannabis medicine. My team of physicians consult with patients all over the world. We've been integrating cannabis since 2001. I've owned and operated 6 integrative medical cannabis clinics in California, New York, and Connecticut. So I lead a team of MDs, naturopaths, therapists, all treating both children and adults. I have extensive medical training, including Cornell, Columbia, and Harvard. And besides my clinical practice, my projects include clinical studies, digital therapeutics, and the medical CBD space in Yunnan, China, and Kazakhstan. So I'm going to begin my slides here. You can advance to the first slide. So I just want to give you a basic 101. This is not going to take long. I want to introduce you to a system in our body that's an essential part of your health and wellness. This is called the endocannabinoid system. And I know you probably never heard of it before now. But if you think about your digestive, your circulatory, respiratory, your nervous system, this endocannabinoid system, this ECS, interfaces with all of those other systems. It's called the master regulator of the human body. Next slide. So look at the CT scan. The CT scan of the brain shows you all of the receptors for cannabinoids in the brain. They exist in every region. It's the largest receptor system in the brain. Next slide. This PET scan, everything you see here lit up is the galaxy of endocannabinoid receptors in the body. They blanket the entire body. Next slide. So if you just step back and just take time to discover the scientific facts of cannabis, we can really make sense of all of this on a biochemical level. This is why cannabis medicine works for a variety of symptoms, from chronic pain to appetite to insomnia to anxiety. Next slide. So phytocannabinoids from the marijuana plant, there's over 100 unique chemical compounds. There's over 1,500 chemical variants of the cannabis plant. Next slide. And it's not just about THC and CBD anymore. There's over 100 cannabinoids identified and more still being discovered. Next slide, please. So like I mentioned, I've owned and operated 6 integrative clinics throughout the US, California, New York, and Connecticut. Our clinics customize treatment protocols and we integrate cannabinoid therapeutics. So I'm looking at cannabis usage adjusted to age, gender, weight, genetic tests, blood tests, even diet. Next slide. Most doctors will not help patients. They will not help patients find relief with medical cannabis because medical malpractice insurance doesn't cover any form of cannabis recommendation. And finally, next slide. So addressing this problem, I started Providence Health. We use technology to empower people to heal themselves. We're quietly working with selected cannabis brands, and we expect to emerge from stealth next year. And finally, next slide. Cannabis is unique. There's no precedent. There's no other drug in the world that we're using both recreationally and medicinally. So I co-authored this cannabis health book, If you like to take a look at it, it gives you a comprehensive overview of all things cannabis, so you can understand how it works and how to use it. I recommend this book to anyone that's looking for a more integrative and a holistic approach to their own health and wellness. Thanks for listening.
Thank you, Dr. Chin. Appreciate your background and slides too. And I appreciate all the speakers keeping kind of the slides focused on the most important things to kind of get across. So I'll start with something you mentioned, Dr. Chin, and then kind of go back to one of the slides that Isaac had, because I think it kind of framed some of the pieces very well. Actually, I'll skip ahead to it now so people can look at it. You just showed us the parts of the body and the brain that light up in terms of the endocannabinoid system. And so could you talk a little bit more about what else does that? Do opioids do that? You know, do they interact with, you know, it seems to me that the body is very much evolutionarily tied into being affected by something like cannabis, and so the benefits of which are getting, you know, more and more research. But from your perspective as a physician and, you know, a scientist and somebody who's actually been prescribing this as part of a treatment plan, could you talk about what strikes you about how it impacts the body in so many ways?
Absolutely. Without getting too deep into the science, things that I prescribe on an everyday basis: triptans for migraines, statins for hypercholesterol, blood pressure medication, albuterol for asthma. All of these prescription medications that you and I will day to day use, 60% of them work on what's called GPCR of the brain, G protein coupled receptor. So the cannabis receptor, so that CT scan that I lit up for you, the cannabis receptor is the largest GPCR in the brain. So if we just set aside our stigma for cannabis and just think of the cannabinoid receptors as GPCR, and 60% of our prescription medications affect GPCRs. So you're just basically thinking about these two different concepts. Why wouldn't we study the largest GPCR in the brain when that's where all of our pharmaceutical medications work on? So when you think of opiates, muscle relaxants, you think of anti-inflammatories, but even your migraine medication, your Alzheimer's medication, all of that works on the same GPCR receptors that the cannabis does.
Interesting, very interesting. And so when you got more knowledgeable about this space, and I'm referring back to Isaac's kind of slide about some of the common misconceptions in this space. You know, cannabis damages the brain. You know, are there levels where it you know, begins to damage? Is it the cannabinoids and terpenes themselves that are causing any damage? Is it the form in which you consume it? What has been your experience in figuring out, you know, how to use cannabis in your practice?
I have not seen studies that show that cannabis damages the brain. However, it can affect cognitive impairment. But so can antibiotics. So can your Benadryl. That can affect your mental state. Your NyQuil. You just have to use it wisely. And so a lot of the studies, the negative toxicity studies, they looked at the THC levels and how much that affects your the psychoactivity of your brain. But they've mistakenly said that it damages the brain. Now, if you are a young child, if you are an adolescent, it does have effects on cognitive and executive function because of an underdeveloped brain.
Got it. As would alcohol, as would Benadryl,
Correct.
as would a number of other things. Okay.
Pharmaceuticals,
so,
correct.
Yes, pharmaceuticals in general. Okay. So, you know, as a parent, I have a 5-year-old daughter and a 2-year-old son, almost. You know, I get asked this question sometimes. You know, why are you involved in this space, and aren't you worried about your kids and how they're going to interact, you know, with cannabis? And I kind of, you know, give my parental perspective, which is, yes, I absolutely would not want my kids using cannabis in you know, any kind of heavy usage or at an age where their brains are still developing and it's going to impact them, just as I would not want them consuming alcohol. Now, it's always tricky to actually stop them from doing so when they're in high school or middle school or college. Or so education is a big piece of it. To tell my kids what will happen to your brain if you do this, and knowing those facts is far more important than to kind of just say it's a bad thing and you don't want to ever touch it. And by the way, we've got a liquor cabinet and we like to consume alcohol, but don't do this one either. From that perspective, thank you for clarifying, your understanding of that. So also, yes.
I just want.
I was going to turn it right over to you, Isaac. Actually, so if you,
sorry.
I wanted you to be able to comment on the same topics.
In terms of going back to first principles thinking, right? When we talk about children and we talk about use and we talk about impairing cognitive function, we're gravitating to conversations about THC, right? And that's the other first principles thing we always have to keep in mind when we're talking about using cannabis medicinally. There are hundreds of active ingredients, and many of them are absolutely safe for children, right? So if you have a product that has been designed for that use and has taken these things into consideration, and then has gone through, a statistically significant clinical process, these are ways to, I think, easily mitigate these concerns quickly and safely.
Thank you for that point. And so let's talk about that briefly. Just some of the major cannabinoids, so that the audience has a understanding of what we're talking about here. There are a significant number of combinations, obviously, of cannabinoids and terpenes, but and anybody on the panel is welcome to kind of start off this conversation. But could you group them into different kind of classes? Let's say THC being on the psychoactive side, and certain other cannabinoids on that side. CBD with less than 0.03% THC content, which is what's allowed in the U.S. on the CBD front. Maybe if you want to start off with that, Isaac, and then Jay and Dr. Chin, if you want to comment on your views on that aspect of it, it would, I think, help the audience just frame what are different things that come out of the cannabis plant, and how are they being used, and kind of what are their different properties.
So if we start with the three broad categories of active ingredients and just to be clear, we're talking about the flower of the female plant, right? And for medicinal use and for recreational use, traditionally, those are females cultivated in the absence of males. And the reason why that's done is because the female flower creates a sticky resin through its hairs, right, which are trichomes. Those are the factories of the two primary active categories, which are cannabinoids, right? Your CBD, your THC, your THCV, your CBG, your CBN, all of those, and there are about, depending on whose opinion you trust, about 112 to 114 have been identified, and estimates or guesstimates are that there's probably somewhere between 150 to 200 once we really dig in. So your TCD, they are similar, and so that's why the varieties of the plant that we have still available today will be heavy in those. Important to note that prior to prohibition, we have no idea the variety that was available because of our aggressive attempt to remove the plant from the planet. The next group of actives are flavonoids. These are probably the least studied of any, but do hold great promise. And then what we actually focus on the most are the terpenes. Terpenes are aroma molecules. They are found in all plants in nature. Unique to the cannabis plant are the quantities and the specific variations and varieties of these terpenes. Terpenes from cannabis, even though you may be able to identify a peak terpene, for example, example, limonene, which you can also source from a lemon. The other terpenes sourced from other botanical sources do not and are not equivalent to terpenes sourced from cannabis. The current thesis, though it has, to my understanding, not been defined yet, is that the specific combinations of terpenes are unique to the cannabis plant. And since the plant, and for those of you who know cannabis sativa, if you know it by its legal name, sativa means cultivated, right? So the name of the plant is cultivated cannabis, i.e. it is a domesticated plant. It is like a cat or a dog or a cow. And humans have been working on modifying, improving this plant for all of its uses for about 10,000 years. So it is not an accident that it is highly effective. It is on purpose. It is perhaps the greatest single technology that we have received from our ancestors, who were all agrarian. So again, the three primary active ingredients: cannabinoids, flavonoids, and terpenes. And most of the medicinal use and efficacy for specific indications comes when you focus on the terpenes rather than the cannabinoids.
Thank you, Isaac. Jay, did you have any thoughts on kind of describing this topic, composition of the plant, and how you're kind of looking at isolating and working with different cannabinoids and terpene mixes?
Yes, absolutely. It was great listening to all you guys thus far. I'm in full agreement. I think currently the full flower approach, the full spectrum approach, the whole flower approach is a much better and much more of a medicinal approach. I do, however, think that to get a deeper understanding of how these unique cannabinoids, terpenes, terpenoids, flavonoids, other isolates in the plant work, we do have to isolate them and then study them at an individual level to understand kind of their effects. And then the amount of synergistic effects these different variants and different ratios have is just tremendous. And it's very dynamic. So we do have to draw from a lot of anecdotal evidence, historical evidence, what strains, different ratios of cannabinoids from what regions of the world were used for what purposes. So some of that data is, it's hidden in books, it's hidden on the forums. So that's how I'm kind of looking at this and learning from from a lot of cannabis consumers, whether it's on the recreational or medicinal front, looking at all the current studies that are going on, and frankly, also self-experimenting with various isolates with various formulations.
Thank you, Jay. And Dr. Chin, if you had any thoughts.
I think you guys covered it 100% very thoroughly. Yeah.
Okay, let me turn over to the audience for some questions, just so I have a bunch of others, but I just want to make sure the audience has a chance to identify, any fundamental questions they have about the plant, how it affects the body, the mind. So please feel free to jump in.
And first of all, in terms of the products that we work on, none of them are for combustion. My point was that we've been taught that smoking cannabis causes lung cancer. And so if you move forward with that belief, I think it's impossible to do good work, right? Because it's not objective. It is a fictitious statement, and it comes from trying to associate cannabis with tobacco. And that's, for me, that's a leap too far. Again, in terms of FDA, and we have spent a tremendous amount of time on this question. We've done so with counsel. We just fundamentally do not believe that FDA approval is required for clinical use. It is required to make claims. We have no plans to make claims to the public. In fact, we disagree with the concept that the public should Google symptoms do their own research, and then buy a product. Our whole strategy, our whole belief is to focus on indications where we already know cannabis can be highly successful, where there are no good pharmaceutical solutions, and to educate those doctors, not their patients, so that those doctors can use our products. And we may disclose everything to the doctors, right? So they get all the information, all the clinical trial results, and can make their own decisions about if and how they want to use our products with their patients. What it does do, though, is give them a very clear answer to the question, what product do I use? Right?
Focusing back on understanding the physical effects, Dr. Chin, you were kind enough to share kind of your personal story in the spotlight video that you shared with us. Could you talk about where is the understanding for physicians today about cannabis? Are there more and more physicians kind of taking a look at the space? How has that shifted since you've been involved for 20 years? My parents are both physicians. My mother being in internal medicine, still practicing. And, in the last 3 years in particular, she's had a number of patients come up and ask for cannabis rather than opioids as a solution for things like pain and also in other applications. So just curious how you've seen it be effective in your own patient base, and also where do you think the community of physicians stands today in understanding the plant?
I think it's changed quite a bit, and I'm actually very, very optimistic. Here in New York, I have an education platform, and we just got notification that we will be the approved educational platform for New York State Department of Health that all physicians will need to take before certifying medical cannabis patients. Also in New York, compared to California, where I started, it's a very robust medical program. So when I get referrals from Mount Sinai, from Sloan Kettering, from Cornell, from NYU Langone, everything is logged into what's called the Prescription Monitoring Program, a PMP. And that's the same program that gets monitored when you get an Ambien prescription or Xanax. When you go pick it up at pharmacy and CVS logs it in, they'll see that you've picked it up, and the physicians will see that you've picked it up. So there's some checks and balances. I'm also educating about 2,500 physicians this month through, it's called the Independent Physician Network, IPA, because we are looking for third-party payers to start covering medical cannabis, Medicare and Medicaid. So I think that physicians understand that patients are going to try it with or without their consent ultimately. So they better get on board to be a part of that conversation.
And what do you think is lacking in terms of the ability of patients to understand the space better? Is it, just federal dollars not going into providing more research, more applications conducted, with enough rigor to show physicians the effectiveness of it? Where are some of those gaps?
Well, no, I think as a group, physicians are conservative. My colleagues are very conservative, and we're very linear. And so because we weren't taught this in medical school, it's very hard to adapt plant-based medicine, or integrative medicine. And so I look at this sort of, it's really turning healthcare upside down. And we're really thinking about, CBD as preventative medicine, as, more of an anti-inflammatory, like your Celebrex, like your Vioxx, like COX-2 inhibitors. Those are the things you might take if, Voltaren, if you've had arthritis. So CBD in that sense is very similar to that. And I think physicians are understanding, but they are just very slow moving. But when I look at NYU Langone or even Montefiore here in New York, Albert Einstein, they receive federal funding like Department of Justice for their cannabinoid clinical research. So it's coming along.
I have a common question for you, Dr. June. It's very good to hear about these programs at a state level. When do you think, and I'm in agreement with you that there's a generally physicians are very conservative, just when it comes to kind of plant medicine, because the education is kind of very pharma, chemical, single compound driven. But I do see a wave and a trend in California and a lot of different states. When do you see just the kind of the educational system changing for physicians, like more education on plant-based medicine in general, just broad spectrum? And I do see there's being a lot of synergy right now, especially in California on the west side. From the psychedelic space and the interest in microdosing, mental health, and then now that's being leveraging back to cannabis, and so it's working
Absolutely.
a lot more harmoniously now.
Yes, absolutely. Especially with the Johns Hopkins psychedelic funding, I think it's already happening. We're just not hearing about it as much. The lay public is not as much. But you can also see, not even at a graduate level for medical doctors, but an undergraduate level. I just taught a course at Cornell, my alma mater, Syracuse University, having a certification for undergraduates in cannabis, both in agriculture, in science and research, and in health applications and law. So I think it's happening slowly. We just have to give it a little more time.
Thank you.
Just so I don't hog the questions, anybody from the audience want to ask any questions of the panelists? And hey, Jack, good to see you.
Well, if nobody else has a question, I don't know if I can speak for the rest of our community, but, you know, number one, I put it in the chat. This is great information, even for those of us who think that we know about cannabis. And I really, you know, emphasize that part, the think part, that we know what we don't know, right? And so, like I said, don't know if I'm speaking for the rest of the community, but please let us know what we can do to help you. You could say, you know, get the real information out there and, you know, help, you know, dispel a lot of this misinformation out there. Anything that, you know, we as a community, or that, you know, I can do, Anon, or, you know, you can refer it. But yes, thanks. And yeah, we need to get the real information out there.
Thank you for that, Lauren. I want to add something, because there's different levels of experts on this panel. And I want to add something that I believe that even the experts in cannabis, the current state of affairs is that even the experts don't know much of what's going on, how the behavior, how these cannabinoids are behaving. Dr. June talked about the receptors in the brain. I investigated TRPV4 receptors. There's CB1, CB2. The reality is we don't really have much of a clue on what is happening. One could argue that we know more about THC, less about CBD, back and forth. And so I think it's a very important point that the approach for drawing data on cannabis and hemp is beyond just scientific. We have to go to historical data. We have to look at anecdotal data. We have to look at the consumer and the patient experience. We have to draw data from within ourselves, from our usage.
I agree. I agree. Everyone always says, well, there's no clinical research, there's no double blind, you know, placebo controlled. And I say, I've been sitting on anecdotal for the last 20 years, and that means something. And when you look at, you know, animal models and you see that the cannabinoid receptors, the CBD, THC, all the other cannabinoids work on serotonin and GABA. And these are the same receptors that, you know, you use for your migraine medication. You know, so this is, you know, we're sitting on something that deserves more attention, more money for research, to pursue. We owe that to our health and wellness.
No, that's fantastic. Our understanding of just in general neurotransmitters, it's growing quite rapidly, but we didn't even know that glutamate was a neurotransmitter. We didn't even think it's so abundant in the body. So, and our traditional understanding for a lot of drugs has been, you know, like, oh, this is a serotonergic drug, this is a dopaminergic drug, this is predominant, but what we're starting to kind of see, and this is kind of, I think what you touched on, Dr. June, is it's much more dynamic than that. Like, these drugs are working. I don't think cannabis is working on one of these. I don't think like a recreational drug like MDMA is working on one receptor. I believe they're having a much larger and grander impact on the brain.
Yes, I think it's Mother Nature laughing at us because we separate these molecules like we know what we're doing. And, we have this linear path in the research as a scientist. I was a biochemistry major, so I'm pulling apart molecules. I understand that because I can wrap my head around that. But we realize there's so many moving parts. And when it comes to preventative medicine and especially the state that the world is in now, it's really more important than ever. Regenerative medicine, preventative, nutritional medicine, and plant medicine, cannabis plays a big part of that.
Let me,
Absolutely.
I have two questions. First, Dr. Chen, in terms of your contacts, have you bridged or come in contact with Dr. Chen at UCLA and his work? And
Yes.
also Dr. Benjamin Kaplan up in Mass?
Yes.
Because what you're touching upon, anecdotal evidence, and mapping all that out and typing it by people with different chemistries, every single human being unique with a fingerprint, okay? Getting from that to an Epidiolex or a workable actual drugs deliverable is a myriad of, it's a big issue to try and get your arms around. So I'm glad to see you're talking to them. They're two of the experts I know.
Absolutely. Yes, we are working together.
And you're collaborating. That's great. And my second question really is for the whole panel, understanding what Jay has built with Alt, okay? The delivery systems, right? The different, once we arrive upon workable combinations, whether it's at the molecular level or more, how do we discern, and what kind of work are you doing, Dr. Chen and Jay? Why did you select, for example, the liquid THC delivery system of Alt versus combustible, like Mark Singleton brought up earlier, and things like that? Are there avenues and lanes that you prefer? And are you typing your research, your anecdotal research, by delivery system as well?
I can take a portion of that first. I think as a scientist, my background's in biochemistry as well, and my undergrad research and my area of focus was the RNA world, the evolutionary steps. I think it's very important. So I'm just in general very, very curious on exploring every possible delivery mechanism and method, because I think in nature it happened accidentally, just at every extent, even injecting, right? Like you might imagine that if you're out there running, you'll rub against plants, you'll end up getting some in your system one way or another. So I think there is a tremendous benefit to exploring every form factor for purely medicinal reasons. And then I believe all these recreational reasons are also medicinal reasons, and some of these medicinal reasons are recreational reasons. And that's a great point that Dr. June brought up right in the intro, that there's with cannabis, it's a very unique situation, and it seems to be the first plant compounds that we're approaching it with the lens where it's recreational and medicinal.
Yes.
So sorry.
Well, for me as a physician, if we could avoid lung irritation, I think that's great as a first line of defense. I much prefer, liquid formulations. If you can infuse it into your beverage, if you can do an edible or a tincture or even a capsule, or a tablet, if you want something controlled by a dose. But not all patients actually can metabolize it. I've had patients that, have 30 milligrams of THC in an edible and does not feel a thing, but if they use an inhaled version, it seems to work therapeutically. But, any inhaled substance will affect the respiratory system, whether we like it or not. And when you look at cannabis smoking, the inhalation pattern with cannabis smoking is a little bit different than tobacco smoking. But I think with the different technologies, the different companies that are working on controlled combustible, whether it's through a vape or temperature controlled, looking at puff volume. I mean, they're looking at aerosolized albuterol type sprays for cannabis use as well, and the bioavailability of that. So really, it's endless, because you're using plant medicine, which is where the whole pharmacopoeia comes from anyway. And we're trying to translate it into different form factors to meet our unique biology.
Thank you. Sorry, just a note on that. That's a great question and feedback. And Isaac, I wanted your input here too, because and the reason I asked this also is, I know so many users that are using it for different applications. I know folks that are in their 60s and have a hard time sleeping through the night, and so they will take a tablet form and they'll take 25 milligrams before they go to bed, and they will have a very peaceful sleep. Before if they got up to use the restroom, they would either have a bunch of work stuff come in their head and couldn't go back to sleep, or whatever the reason might be. But with this, they swear by it. Now, if they took 25 milligrams combusted cannabis, they would have a very different experience than taking it in that form. And so but there are certain benefits, recreationally or medicinally, that I've heard, again, anecdotally, coming from the combusted form that are not necessarily achieved from other forms. And Isaac, I thought you may have some thoughts on that front.
So yes, delivery is important. One of the big challenges is oral delivery, right? People like capsules, tablets, but if you're focused on terpenes and you put those in a capsule and you swallow the capsule, you're going to destroy all the terpenes. You're not going to get the medicinal value. And so, work that Jay's very important, because what we find is if you can get the absorption mucosally, right? So before you swallow, it's far more effective. And there's a lot of work done in that area. Baileys are using a lot of nasal sprays, which we're not allowed to do in this country, but that is also highly effective in a fantastic delivery.
So let's talk about that for a moment, because this is, again, a question I've been kind of thinking through and looking at different articles on. But in terms of what is the most quick acting part of cannabis? You said mucosally. I believe the connection was a little choppy there.
The lung is fantastic.
Right. And so then how do those do those forms of taking impact kind of affect the body in different ways, if you have data on that? So I'll lay out the kind of groundwork. So, getting it through your orally, right through into your bloodstream, if that's an option, or inhaling it through a nasal spray, I guess would take it to your brain the fastest. I'm assuming the next fastest maybe is the lungs, the next fastest being the stomach, the next fastest being the liver. I'm kind of in a lay person's way laying out different options. Are there any of the panelists have any thoughts on how those different formats could impact somebody who's using it for specific purposes? Let's say one purpose is just recreationally. I want to, have a great feeling and be able to go out to dinner or somewhere else to a concert and have a good time, versus somebody who wants to have a full night's sleep and kind of rest and doesn't care about it taking impact right away, and they can wait 30-45 minutes as they kind of go into their sleep ritual. Any thoughts on that front?
I would, Anand, that was a really interesting and good question. I think I'll start the answer and see if the other panelists agree with me. I would split it. I would add one more delivery method to it. There's always injections as well. There's enemas. So you can consume in many various formats. I would break this down, I think, in two categories. One, where it's going through the liver, and second, where it's bypassing the liver. So I think the experience, and there might be more ways how this can be split up, but I think when you are inhaling, inhaling, or vaping, or using a nasal spray, perhaps, you're predominantly bypassing the liver. So you're getting the more effects of the delta-9. if you are consuming orally in the traditional format, it's going through the liver, or the THC, that component of it is, we know the delta 9 is breaking down into one of the metabolites, 11-hydroxy, which is a completely different effect from consuming delta 9. So I think that's where we're getting the variation in the consumers and the patients, that why certain people are enjoying eating traditional edibles, why certain are enjoying beverages versus others who will only depend on smoking. And I would add one more thing, which Dr. June touched on, the kind of the dosing and precision. Isaac talked about it as well. That was the key, and the precision dosing was the key inspiration to the current product formulation and the company I'm with, Alt, was to create a product that you can measure out, and it would bypass the liver and give you the effects similar to that of smoking or vaping, which was executed by reducing the particle size of the THC. So I'll leave it at that. And if there's any follow-ups or additional add-ons, I'd love to hear
it. I guess in terms of the way we see it in terms of preference and efficacy, right? The lung is a fantastic delivery system, right? The challenge is you're joining, and you've got boiling points, certain active ingredients that it's going to destroy, and they're never going to be delivered to the lung. Things like dabbing and vape, again, you have a temperature, right? Bring in hot temperatures, it's the lung, and because various of the actives have different boiling points, you're not going to get full delivery of the active. So to address the lung, there's still R&D that needs to happen. In an ideal world, you'd be able to, when Jay talks about out in nature, right, when we were all farmers and we were growing cannabis and we're bumping against these plants, the air was rich with trichomes, right? And so we would be breathing these in both through our nose and our mouths. And so you'd be dosing mucosa, so your nasal mucosal, your oral mucosal, and your lung all at the same time with these little hairs that are easily absorbed. And so you're really dosing all different parts of your body all at the same time. And that's where it started. And so trying to replicate that in a clinical or a user setting is part of what we're all working on.
Yeah, that was great. And I actually believe when we were evolving and underwater, the development of these are just theories and shots in the blind based on just scientific intuition, if I may call it. But the development of the endocannabinoid system in the brain, how did it develop? At what part of evolution were we underwater? Was there cannabis present around? What was the abundance level? What was the concentration level? So really good point, Isaac. Replicating on how much THC, cannabinoids, mycelium, these different compounds we ingested naturally in nature and how they got into our bodies to evolve to this point and to remain whole and healthy. That's going to require a lot of work.
Any thoughts from you, Dr. Chin, on that?
I think at the end of the day, it's going to be up to the consumer, the patient, where they get the relief for their symptoms and disease. I have a migraine patient. She needs the inhaled version of the vape. So when she wakes up in the morning and there's barometric pressure is different, or she didn't get enough sleep the night before, she can use the vape so that the migraine doesn't come on. But she knows when she uses the tincture or a sublingual strip that goes, right between the mucosal membrane, or an edible, she can stay ahead of the migraine, and it decreases the actual frequency of the migraines. So, you're looking at using different form factors for different symptoms, different times of your menstruation cycle even. So there's a lot of nuances. And I think if you have a great health practitioner such as myself that can help you walk you through that, I think it's quite helpful.
So thank you for that. So let's chat about that a little bit, because, you know, I'm getting, every time I interact with people, I'm getting more and more just information from them about the medicinal side and helping their parents with different issues, or themselves with different issues. You know, let's talk about migraines. Is there, you know, have you in your experience seen a lot of patients be helped with migraine? And if so, in specifically with which kind of cannabinoids? Is it CBD? Is it a mix of CBD and THC? Is it another mix with more of an entourage effect with terpenes included in there? How have you seen it be most effective for people who suffer with migraines?
It's usually a mix. I've had patients that, I would say most of my patients do both a mix of CBD and THC, like a 1-to-1 ratio at night. So it's not too psychoactive, but it's just enough to create a relaxation and sedation during the evening. CBD is great anti-inflammatory during the day that will help decrease the inflammation, which is the heart of the migraine. And then they will microdose with THC in an inhaled version through a vaporizer pen or through a flower to offset. It's like the rescue formula, you know, your Imitrex, you know, that triptan that you'll take right away when that migraine's coming on. They would use that inhaled version as the rescue formula.
So it's actually a kind of preventative, and then if it happens, kind of a anti-inflammatory, and then kind of a coming out of the migraine piece that is most effective, you're saying?
Exactly. And those with migraines know, you know, there might be certain female patients, there might be certain times of the month where the migraine will get worse. So we will preemptively guide them to take more cannabinoids, more CBD during certain days of the month. If it's a male patient, it might be sleep hygiene. So if they know Friday and Saturday night, I'm going to go out, I might need extra cannabinoids during the weekend because my sleep hygiene might not be that great. So I don't get that migraine on Sunday or Monday.
Gotcha.
That's a great point, Dr. Chin. Sorry, I didn't mean to interrupt you, Anand.
Go ahead.
It's our understanding of our diet and medicine is progressively growing, and one of the things we're starting to understand is not just for females and the menstrual cycle, even for males, like our diet, our medicine, how Dr. June broke down the kind of the consumption of cannabinoids throughout the day as preventative, and then to relieve the effects. Just like that, our diets, consumption method, the formulas is not the same on a daily basis, not on a weekly basis, not even perhaps on a monthly basis. We don't know what the cycle looks like. It's kind of a flow that we have to let the individuals and kind of figure out. And I do have tremendous respect for the physicians and medicinal practitioners that are progressive enough to allow to give some of the care and put some of the medicine into the patient's own hands and let them self-titrate and kind of self-regulate a bit. We do that with everything else in life. And the consumers, the patients, need to have that freedom, I believe, to kind of figure out their own system, their own mechanism, delivery methods, formulation. So I think an abundance of ethical products in the market, delivery methods, is an important component. Yes.
Thank you for your thoughts there. And so let's talk about some of the factors that, again, this is anecdotal because there is not federally backed research doing it in great detail yet, at least in the US. But how are men and women impacted? Obviously, with alcohol, something like alcohol and other recreational or medicinal items, it can depend on sex, it can depend on weight, as some of the common factors. Is there a clear trend line? Again, anecdotally, I've noticed when people I know who are females consuming it, they could be more sensitive in certain ways of consuming it versus males. But in your experiences, have you seen clear differences in what to either recommend or how it impacts men and women, and maybe by weight or other factors?
Estrogen levels will really make us more sensitive as females to THC. There's actually a study through the University of Washington estrogen will amplify THC. So you might even notice on certain days of your cycle, you're more sensitive to cannabis than other days of your cycle, or your partner or your friend who's male might be less sensitive to cannabis, and it's usually because of our estrogen.
Interesting. I did not know that. So that's something new I just learned. Okay, interesting. Any other panelists have thoughts on that as far as what you've noticed in terms of factors that affect the experience with cannabis?
I believe about 10, 15 years ago, in the span of those 5 years, my early usage of cannabis and kind of entering the space, it wasn't being investigated. This one point I'm going to make wasn't being investigated almost at all. But it was, I'm Pakistani. I consumed cannabis throughout college. I consumed cannabis with a lot of different, all sorts of different people in lots of different professions. And one of the observations I had was it was impacting people differently, not just like the potency that for some it was stronger, but the effect curve and the dose curve was very dynamic between the different people's genetic makeup. So I think it's the estrogen point is very fair, but it's so much more dynamic than that. Than like, for example, certain enzymes like FAH, how you metabolize that, your receptor ratios on where they're laid out in your body. One of my really interesting observations was that consuming cannabis with people from the West in general, if they took a dose that was kind of on the higher side, they didn't get, majority of them did not get a very negative effect. I observed this is at a very young age when I'm smoking with lots of people. And I noticed that people, when I consume cannabis with people from within my own family, my extended family, my cousins, we all had this one negative effect at a dose beyond a certain point. We all ended up throwing up. We would all throw up. We would not just go to sleep. So I started talking to every doctor, every scientist I could possibly reach out to, and discovered, all these different components. And I will add one more thing to the genetic component. I believe it goes even beyond that. There's an epigenetic component as well. As you age, how I tolerated or was affected by cannabis as, when I was in my teens, 20s, was completely different than how I feel the effects as a 35-year-old now. So genetic component and a epigenetic component, genes turning on and off as you age.
And that's no different with common asthma medication. African Americans, Puerto Ricans don't respond well to some of the most common asthma controller medications. When I treat children with epilepsy and adults with epilepsy, those with Asian descent are supposed to get genetic testing before even being prescribed conventional seizure medication. So why wouldn't, cannabis medication be any different? So that makes a lot of sense, Jay. I'm glad you brought that up.
And I'm very happy to see now, actually, one of my, now a good friend has a company called EndoCanna, who is doing a pretty comprehensive DNA test and looking at all sorts of different variations. So it's like a 23andMe kind of test. But yeah, Dr. June, really good point. I think the genetic testing component for just in general is very, very crucial. And as our knowledge base grows on all the different receptors and different genes, we can draw tremendous amount of data from that. And it's not just the medicine or the asthma medications or the cannabis that's affecting us differently. It's food too. Like technically, all of it is medicine, right? So certain people, like my genetic, I do comprehensive testing on myself, every DNA test I can find. And one of the superfoods, beets. I can't tolerate beets. I can't eat sweet potatoes. These were not present where my people are from or as we were evolving. So it's dynamic.
But cannabis definitely was. Jay.
Yes. Cannabis I was a big stoner in college.
Sorry, somebody was speaking. Didn't mean to cut you off.
Yeah, if I can just add, you
Yeah.
started with the question. You started with the question differences between male and female, and I think the real thing that everybody needs to understand is that your endocannabinoid system is unique, right? You need to be intimately involved with your own journey in terms of what does and doesn't work for you and how it impacts you, which necessitates expanding your ability to listen to your body and how it responds to things, right? One of the very important, again, first principles with cannabis is there is no mg per kg or dose per weight formula, right? It does not exist. And as what I like to point to anybody who thinks that is not true, if you go look at the dosing instructions for Epidiolex, which is legal in the United States, or Sativix, which is also by GW Pharma, but only legal in the EU, and you read their instructions, you will see very clearly that it requires titrating to the dose, and there is no shortcut to that, right? We've grown up where it's take 2 aspirin and call me in the morning. Cannabis does not work that way. Right there, you can meet a 300-pound muscle-bound person who takes 1 milligram of THC and is knocked down on the floor, and a 95 milligrams too, and they shrug their shoulders and say, "I didn't feel anything." So you can't get away from that. And most importantly, we believe if you're trying to do clinical use, this is not something to do on your own. Please find a doctor like Dr. Chin, someone who is experienced and understands and can help you pay attention to whether or not it is helping you. Do not Google this. Do not do it on your own.
Yeah, that's a great point, Isaac. I again, being in this space and then knowing folks and since undergrad and understanding this plant starting then, at a very basic level, but that journey, I've seen so many instances of exactly what you described. Somebody who otherwise you'd think that would have high tolerance for something like alcohol, when it comes to cannabis, does not, and vice versa. On that front, and this is why I tell people I'm in this industry for the next 10 years plus, because there is so much complexity in understanding how the interactions between these components of the cannabis plant impact people, and how they would fine tune it to best improve their lives. I have a relative who has suffered from migraines all of their lives, very difficult for them because they are a physician and they need to show up at work whether they get a migraine or not. And if some of these, and they've tried everything in terms of medicine, and they usually can find some respite if they can see it coming on, whether it's from too much direct sunlight or whatever the causes might be, which are tough to figure out on a day-to-day basis. But the impact to people and how much they should take to benefit from it, I think, Isaac, you have a great point. You should look to try things in a controlled way so you can see your own journey and your own reaction to things like CBD, or if you try THC or other different forms of how you're consuming it. Because one of the challenges for the industry is people will go and take recreationally an edible and find out 45 minutes later, or sit there for 10 minutes and say, I don't feel anything, and then they'll take some more of that edible. Or the worst is if they went to a friend's house who made brownies and they don't know how many milligrams of what is in that, and they take too much, their reaction could be that they feel a high degree of anxiety, or are not able to kind of go through the experience of what they took, and not be able to use that data point in the future. And so educating people as they're starting to interact with cannabis to kind of take it slow and see how they're reacting to different things, and seek out medical guidance, I think is very important, because you don't want folks to turn away from it. You know, if I tell people on the recreational side, if you're taking alcohol and you took it in a pill form and it was the equivalent of 5 shots of vodka, and you had no idea until half an hour later, and you took 3 or 4 more of those things, well, you're going to be in a lot of, you know, trouble, as you would be with anything in medicinal form that was concentrated and you were taking in edible form as well. And so speaking about the plant, you know, as this industry progresses, how can cultivation kind of start to and processing and turning it into the product get more fine-tuned? This is to the panelists, do you see, you know, more and more anecdotal feedback from consumers as each person identifies what was effective for them or not being collected, and then kind of start to be mapped in terms of what are the right delivery mechanisms and form factors, and then that making its way back to, you know, the cultivation side and the cultivators understanding what they should focus on in what they're providing to the industry. How do you see that aspect of it evolving?
If I may jump in really quick on this one, I think there has been evolution, a very rapid evolution and impact on the type or the way of breeding for the last 10, 20 years in cannabis. And it is now slowly evolving out of this style. And what I'm referring to is that I believe for the last 20-ish years, the focus has been on breeding high THC strains predominantly. Then there became a shift when hemp and CBD became more predominant on the radar of people for medicine. There was a growth towards developing strains that were higher in CBD. But I think to answer your question a little bit more precisely, Anand, I think it is now evolving a little bit more as we have experts like Dr. June, and very impressed by executives like Isaac on the deep understanding of different cannabinoids, or at least understanding that we lack the entire understanding. So there's kind of needs to be, I believe, a natural progression on the cultivation side and how we breed these plants. That's a very important component. And I think it is very crucial to secure and create seed banks and not lose the landrace strains. That's a very important component to it, because as you know, we've already
sorry, which strains were you referring to there for the audience?
Landrace strains. So just for the people, the audience, landrace strains would be strains that like existed natively in different parts of the world. For example, like Colombian strains, Mexican sativas, you know, I guess Durban poison could still be considered one of the landrace strains left over. What happened is that these landrace strains, a lot of them don't have a high yield, meaning they don't have a big output when it comes to weight. Or if these are sativas from certain parts of the globe, they take a very long time in maturing, sometimes up to 24 weeks, 24 weeks. Whereas strains have been bred that will mature in 6 to 8 weeks. So being from the business point of view for companies, if they're manufacturing flour or other products, it is much more profitable to breed strains that would mature as fast as possible with the highest amount of THC, with the most amount of weight. And that kind of ended up dictating the impact on consumers and the patients, because the amount of the variety of cannabis became limited, and it became driven by just capital. So I think that's why it's very, very crucial that these high strains, Pakistani, Afghani, Colombian, Mexican strains, we preserve these landrace strains, use them, do extraction from them, do all these isolates, investigate the ratios of cannabinoids that exist within them, make those types of formulations available to the consumers in different form factors, and then draw data from that. If we just go by what's predominant in the market, what's being sold in a lot of states, we would find that majority of the plants are just hybrids. with very high THC, or they're on the other end in the hemp space with high CBD.
That's a great point. Any other panelists want to comment on that one?
I think the biggest change is really needs to happen at the processing and product making, right? So I think in terms of cultivation, we have decades of experience, right? So if you look in regions like Southern Oregon, Northern California, you have second and third generation cultivators, highly conscientious. I agree with Jay. The key thing we need on the cultivation side is variety and moving away from the simplistic approach of THC and CBD. The single biggest change that I think that needs to be made is to focus on terpenes, right? If you look at the plant in nature, it is not uncommon for varieties to have a 3-to-1 ratio of cannabinoids to terpenes, right? So for every 3 milligrams of a THC or a CBD in the plant, one would expect 1 full milligram of terpenes. Most products, in both the rec and so marijuana in the recreation market, CBD products, they do not test, they do not provide information on terpenes. And if they did, this would quickly flush out 98, 99% of the participants, because maintaining terpenes in your product is very challenging. Right? And it is not practiced because it's not on the package, right? If you started looking for a 3-to-1 or 4-to-1 cannabinoid to terpene ratio in the products that you want to consume, you would probably be left just with flower today. And that's because many of the processing techniques that are used at scale, ethanol, specifically when you look at hemp, because of the way it works, it leads to a product that needs further refining. Every step in a process, you lose actives, especially when there's volatile as terpene. So I think if we could make one change that would positively impact the entire supply chain and quality of products that people get, would be to focus and specifically on cannabis terpenes in the products. Everything else would fix itself.
Thank you,
Isaac. What an
appreciate that.
That's such an amazing point you made. And I'd like to actually share the experiment that Anand brought up earlier that I was running in the lab today that I might jump.
Before you do that, Jay, I just wanted to thank the panelists. I know, Dr. Chin, you may have to hop, and a bunch of the attendees may have to hop because it's 1 o'clock, including myself in a couple of minutes after Jay shows us. But feel free to hang out and continue the conversation until Mark Sainer and Anessa say we need this channel for something else. But thank you to Jay, Isaac Foster, and Dr. June Chin for participating today, and for all of you in the audience for participating. It was a great discussion, and we'll continue this series and go into a few other areas in the future. So I'll turn it back to you, Jay, and then if anybody else has questions, feel free to continue as long as the panelists.
Thank you very much, and it's really great to hear people who know what they're talking about and are passionate about all of this. Really, thank you very much.
Thank you, everybody. This was actually a very learning experience for me. I learned so much from you guys, and I want to say something about Anand. I've been on panels with him before. I've seen a tremendous evolution in how much knowledge you've acquired in the last 3 months. Like, you're becoming a mega ship, and the questions you're asking now are like, they're a whole different level from when we started talking a couple of months ago. So I'm very grateful for this entire panel, for you guys for putting this together. And like, I wish I knew Dr. June when I was a child. Like, I think everybody should become her patient, and all executives should learn from Isaac on their approach for product development and how to run these companies. And one last thing I was going to share very quickly, and then I have to hop off too. The point you made about terpenoids, Isaac, the experiment that I'm running right now is exactly that, on how to maintain as high of a terpene content or terpene load, or in execution of the final product, it is not an easy part, right? Like if you want to have decarboxylated THC and you're starting with almost 100% THCA, how are you going to get to Delta 9 without losing terpenes? So I'm running all these insane experiments under vacuums, under blanketing these concentrates under helium, under argon, to see how it can be preserved. But one thing I do want to add, I don't think we've ever explored eating cannabis raw, but there might be something to that, because even when you cut the plant on day one, it starts losing terpenes right away before you even dry it. Hence the whole fresh frozen concept and doing extraction from fresh frozen. So that's my experiment right now. I have all these temperatures running and I'm measuring their terpene content. And I'm frankly, other than doing analytic stuff in the lab, I'm actually going to just consume some of them and going to hand them out and see how they affect people.
Awesome. Raw cannabis.
Yeah, good concept, right? We should talk about that.
That's got to be a format that was used historically. You know, in India, you know, as part of the Holi festival, they used to infuse it into milk, and they still do. And so, you know, there's so many different historic forms of.
Well, if you guys are in New York City, we opened up the first cannabis cafe on Soho in Canal and Broadway, and we serve raw cannabis leaves in our salad.
Wow, there you go.
Yeah,
that's amazing.
Come on over, Jay. I'm getting hungry for lunch.
Well,
so,
we'll meet for lunch there.
There
I'll
we go.
bring flour.
And so to your point, Jay, yes, there's been a huge evolution because, you know, to make cannabis really happen, we got to put together more people and be able to have panelists that can ask each other questions and connect. And so we're actually going to continue doing more and more of these events on Zoom, in person, in the Midwest tour, which is coming up starting tomorrow. I fly out to Chicago. You know, the 361 Firm group is going to be in Chicago, in Detroit, in Ann Arbor, in Cincinnati, in Cleveland, and Columbus, not in that order, but and so I look forward to meeting a lot of you there. And then Bar Capital is launching a new podcast called Raising the Bar, where I'll be doing short and long form interviews with participants in the industry in cannabis. So you know, it's really exciting times because things are really taking off now, and people are, you know, some of us, like Dr. June, has been in the industry actively for 20 years, you know, and so the next 20 in this space, I think, are going to be really, really exciting. So I'll let you all continue chatting, whoever can hang around if you would like to. But I unfortunately have to drop so I can get ready for this Midwest tour tomorrow. So thank you.
Safe travels.
Quick, check the message that I
yeah,
sent you.
I'll meet up with you at that pickup spot. I'll Uber it over there, Lauren. So don't worry about picking me up. All right. See you.
Bye, everyone. Thank you. Thank you.
Thank you,
guys. Thanks, guys.
Bye-bye.
Bye-bye.
Interesting.
Isaac, fascinating. That's all I got to say.
Well, one of the things that I didn't want to conclude with a downer, I wanted to ask Dr. Chen this